Like to invite the Director General of the National Agency for Food, Drugs Administration and Control, NAFDAC, Professor Moji Adeyeye, to make a presentation. You're very welcome. Please, let's keep clapping till Professor Adeyeye gets here. Thank you very much.
Thank you very much. It's a pleasure to be here and to speak after the Honorable Minister. He mentioned 4 pillars, and governance is one of the big pillars. Unlocking the value chain is another pillar, and I'm going to quickly talk about that with my presentation. Are we ready? Okay, good. Next. I'm going to talk about unlocking the value chain from the NAFDAC's perspective. And it is a harder way, but on the long run it's becoming easier. I'm going to go through this outline. Next, please. Next, please. Yes, to unlock value chain, you've got to have a strong regulatory system. To unlock value chain, you have to have a strong regulatory system. And a strong regulatory system has to be well governed or well managed with very strong leadership. From the NAFDAC's perspective, what we started 2017 when I joined as the DG was washing our brains, changing mindset. And this applies to any MDA. We've got to change our mindset by thinking quality in whatever we do. So in 2018, we started quality management system that focuses on the customer. Strong regulatory system is mandatory for Nigeria to have attraction for investment. You've got to have strong regulatory system. Whether it is for NAFDAC, whether it is customs, whether it is banking, whatever sector. But for us, to unlock that value chain, we needed tools. We needed tools. And it is money that you will use to buy tools. I met 3.2 billion naira debt and 500 million naira that was spent within 2 months before I came. What do? I told my staff we got to pay the debt. Nobody pays debt in Nigeria. We got to pay debt so that we can learn how not to owe money, how not to be in debt. So for about 2 years, we were learning how not to get into debt. You cannot attract investors if you are a debtor organization. No investor will take you. We started building infrastructure. Please go back. We started building infrastructure. We have dilapidated buildings in the States, and customers come to us. Sometimes they have to go 6 floors at the National Secretariat or the Federal Secretariat. So we started improving our infrastructures. reactivating our ICT. Without ICT, without digitalization, no investor coming from outside. We want to deal with you because there will not be transparency. We started equipping our laboratories. We have 7 laboratories. And one equipment can be 200 million naira, one piece of equipment. We didn't have a lot of equipment. About 80% of our equipment were not working when I came. We started saving money so that we can have money to buy things that we need. Vehicles. NAFDAC goes to nooks and corners of Nigeria to do inspection. We cannot take Okada. So we needed strong vehicles. So we have bought over 140 vehicles, still ongoing. Because my plan is to have 3 vehicles for 3 senatorial districts per state. And, okay, and we still have borders. We have to man our borders, our seaports, our airports. So it's still an ongoing thing. This is part of quality management system and the journey that we went on. We started in 2018, global benchmarking, comparing ourselves with the best in the world, not comparing ourselves with ourselves in Nigeria. You want to get into the international arena, you want to have international investors, you've got to use international standards. So we started with global benchmarking, WHO, global benchmarking. We needed to overcome about 860 recommendations in 2018. In 2022, we took care of all those because of hard work of our staff, and we became maturity level 3 regulatory agency. Only 30% of regulatory agencies in the world have that recognition. Thank you. So that is part of what our tools started doing. Our tools that we had, we started using those to strengthen ourselves. Our laboratories, we have 7 laboratories. One in Yaba, the Central Drug Lab, had recognition as pre-qualified laboratory. Only about 11 of such are in Africa. So we got that recognition also last year. Next, please. We've gotten maturity level 3. We are not sitting on our oars. The world is looking at us. Are we going to maintain it? Are we going to keep it up? So it is a continual improvement that is expected of us. Because we are not staying there, we are going to maturity level 4. When products that we approve in Nigeria can be easily traded. When products we approve in Nigeria that are for quality can be easily traded. I don't divorce quality from trade. You have quality, you sell. You don't have quality, you don't sell. It's common sense. So, with maturity level 4 and what is also called world listed authority, where they will actually come and see you perform, Nigeria can compete very well with the African Free Trade Agreement and globally. Next, please. Talking of construction of projects, of state offices, we have a total number of 26 projects. 4 of them have been commissioned buildings in the different states. 5 are already completed, waiting for commissioning. 9 are ongoing. And 8 are new projects. Why is this so important? In our global benchmarking, regulatory system is what they want to see. What is the environment of your what is the work environment? How conducive it is? How happy are your staff? Motivated staff. Our staff are well motivated, more motivated than ever before. Because if you don't motivate your staff, you will not have a strong workforce. And a strong workforce will give you good outcomes. And good outcomes, of course, good health outcomes. Safeguarding the health of the nation. So that is part of what we are doing to make doing business much easier, which is part of economic growth development. Next, please. These are just examples of different buildings that we have, new buildings all over the country. You cannot do all this without money. The government pays our salary, and we thank the government for that. 99% of our salary, of our money, or whatever we need, we've got to generate. How do you generate that? You generate and don't put it in your pocket. You generate, put it in the bank, the government bank. Our platform. So that you can get that money to do things that you need. Next, please. Laboratories. There is no drug or food that we can approve without testing or using risk-based categorization to test them. We have ISO-certified laboratories. We have 7 labs. 2 are left to be ISO-certified. That is confidence in whatever we are doing in Nigeria. Next, please. Next, please. Unlocking value chain, local manufacturing. Local manufacturing. When I joined the organization in 2017, local manufacturing was my vision, was my drive. And I transmitted that to the industry. We started what is called 5+5. The 5 top products that we make in Nigeria are also the 5 top pharmaceutical products that we import. So we started 5+5 so that people can migrate from importing to local manufacturing. And if they cannot manufacture immediately, they partner with local manufacturers through contract manufacturing. That has led to transformation of our pharmaceutical industry. The goal is to provide the agency a strong foothold for making sure that the products are of quality. If it is local, in 2 hours we can get there. If there's a violation or we suspect a violation, we can shut the company down or shut the line down so that the company will know that you cannot violate our regulations because you're going to be a jeopardy to public health. Next, please. Still on 5+5, we now have 20 newly registered local drug manufacturers that have completed detection that are now WHO compliant. In February 2024, 143 applications were received for regulatory review. Now, if you want to have a new pharmaceutical company, you cannot build and say, come and inspect. Nope. We will ask you, show us your architectural blueprint first, so that we build it, quality into it, not add quality to it. So we have about 105 applications that have received regulatory approval, and 35% of these have completed construction. That is unlocking the value chain. That is creating jobs for our people in Nigeria. That is making sure that we can trade, because we're going to be on the neck of any company to ensure that they have quality. Next, please. We also have what is called the NAFDAC ceiling. When I joined the NAFDAC, we have about 9 products under that ceiling that nobody can bring from outside. We increased it to 34 after some study with the industry, so that the ones that we are making become many in Nigeria. That is creating jobs. We have talked about creation of jobs with our distinguished panel. This is part of what NAFDAC is doing. We deal with thousands of MSMEs. In fact, a lot of our clients are MSMEs. Again, is to make sure whether it is drugs or quality or food, that they have quality. Because they are locally manufactured, because we can get there easily to make sure they are doing things right. In fact, 2 pharmaceutical manufacturers have initiated trading offshore with Botswana, with Kenya. So we have already seen our manufacturers doing the AFC FTA thing. That is unlocking the value chain. Next, please. We did a countrywide GMP inspection. We went through over 165 companies to see their compliance level, not punitive. That led to categorization of our companies: low risk, medium risk, high risk. Now, the high-risk companies are trying to become medium risk. Medium risk are trying to become low risk. It is not because they are high risk they cannot produce medicines that can be used. It may be that they don't have HVAC in their system, and it may take time for them to, to get things fixed up. But we have categorized them as high risk because we are using international standards. So we have 12 companies, we have about 5% of our companies now that are low risk, from 1% in 2019 to 5% now. For the medium risk, because they've moved to the low risk, we have 14 to 17% increase. And the high risk has decreased from 85% to 74%. We are using what we are producing now with NHIA, with the National Insurance Health Authority, and in a pilot with 33 products, using 12 pharmaceutical products, so that we can get quality medicines for our people, just like my Honorable Minister mentioned. We can reduce pain of our people, whatever disease, maternal, child, diabetes, hypertension, whatever. 7 states have been involved in that pilot with NHIA. That is unlocking the value chain. Next, please. Local manufacturing of medical devices. We had companies with that were making syringes before, about 10. We now have 3. What we are doing now is hand-holding them, doing targeted inspection, targeted testing to ensure that their products can be traded globally down the road. So the result of this hand-holding for 2 of our syringes companies is now we are getting ready for them to be pre-qualified by WHO and for NAFDAC to be benchmarked on it. Manufacturing of quality products that are available in our country that can be traded continentally and globally is our focus. We are also hand-holding companies that are making beta-lactam antibiotics for children under 5. We are using the low, medium risk companies. And the goal, again, is to get them ready for pre-qualification when their products can be traded, or when we become maturity level 4, and then they can trade their products globally. But more importantly, is to help our own people, is to safeguard the health of our people, prevent death of under 5-year-old children, especially. Next, please.